So Bobber's last slide is really related to my next, or to the next presentation, which is a state of aging report in Central Indiana. This is a project that is funded by the Central Indiana Senior Fund, which I'll talk about in a moment, in partnership with a Polis Center, who is, if you call it, the lead investigator, but it's not a research project. So the leader of the project. The Public Policy Institute, and IUCAR. So first I wanted to talk about the Central Indiana Senior Fund. This is probably one of the most rewarding projects professionally that I've done in my career, just because I've been working for 17 years in the IU Center for Aging Research, and I'm probably one of the only people who isn't trained in geriatrics. And so my colleagues will throw around acronyms and names and people who are geriatricians or societies that I haven't really been attached to. And so this project gave me the opportunity to go around and learn about the state of aging in Central Indiana and why the work we do in IUCAR is so important to our Central Indiana, but also Indiana, US, and international population. So I have the mission up here for you for the Central Indiana Senior Fund. You can read, so I'm not going to read it to you, but what I will say is this is the only fund in Central Indiana dedicated to supporting programs for seniors. So they do not support research, but they support programs and other activities that are specifically for seniors. And just in case you decide, the awards are around $50,000. To do this report, we got more, but it's a lot more work. And these are the areas of giving that the Senior Fund supports. I also thought that it would be interesting for you to learn who's on the board. And so there are representatives from law, from healthcare, from journalism, from organizations specific to aging, and from advocacy agencies. And so it's a really diverse board of interesting people who like to ask tough questions. And I really enjoy interacting with them. They are very hands-on. And so we meet with them quarterly to talk about our work and what our findings have been. So there was a call from the Central Indiana Senior Fund to develop the State of Aging report, or SOAR report. And they contacted, I believe, Peter Emby to ask if there would be anybody at IUCAR who was interested. And so a few of us signed up, said we're interested, and we wanted to pursue it. So I thought I would introduce you to the SOAR team. And so we have Karen Fredrickson and Sharon Kandras from the Polis Center, and then Brianka Merritt and Kelsey String Marquis from the Public Policy Institute. Polis focuses on data, which all of you know. The Public Policy Institute more focuses on policy related to aging, as well as legal challenges for older adults or anything related to law, where my colleagues from IUCAR, and I think you know Dan, Steve, and me, and Melissa Sherman is a PhD student. Wait, Melissa, she's actually in here. A PhD student from Health Sciences who helps us with the data as well. So I'm going to share with you today our preliminary findings from the State of Aging report in Central Indiana. We started this work in February 2019, and it's a 3-year project. So I'm just going to share with you what we've learned so far, and it's set up in a way that's going to take some explaining. But what I'll be presenting to you are big picture trends, and then the forefront of community concerns, and then a basic needs assessment, and then I'll talk about our next steps. So when I present the slides, what you're going to see on the right side, it's your right, yeah, is what the request for proposals had. So the Central Indiana Senior Fund was really prescriptive in what they wanted, the information that they wanted included in the report. And in some instances, some of the data were already in the report, and they wanted us to validate what they had already found. So what you'll see on the right side is what was in the RFP, and then what you'll see on the left side is either our confirmation that that's the right data to request, or what we found in addition. So for the big picture trends, we first identified potential indicators for each big picture topic. Those are on the right. We evaluated the available data sets, and we assessed the trends and noted the disparities if the data, if there were data regarding race or disability or age or socioeconomic status that indicated disparities, then we presented that as well. As I mentioned before, most of the data was managed by the Polis Center. Most of the quantitative data was managed by the Polis Center. And sometimes we would come across reports and provide it to them and discuss it. So the second portion was the forefront of community concerns. And this is what IU CAR faculty did with help from Melissa. We conducted key informant interviews to identify community stakeholder concerns. Then we reviewed the literature, and it's a little bit different than reviewing referee journal articles. We were actually looking at reports that were developed specifically for Central Indiana, or otherwise reports that included populations residing in Central Indiana. And then the third part is that we are conducting focus groups, so we're not done with that for field validation and refinement of findings. So I'll talk a little bit about how this works, but since it is a three-year project, it is going to take a little bit longer, and you'll see when I present just the key informant interviews that I did, how much time it takes. And then the basic needs assessments, we identified basic needs, and you'll see that as we identified basic needs, we found more than what was provided in the report. Part of the assessment included the size of the population affected, the trends, and again, if there was data that was related to disparities, we included that as well. So first, the big picture trends, and I'm going to be a little clunky on this because these are not my data, but I have seen them, and so I just want you to take a look. This is a little tiny now that I'm looking at it, but it's bigger on your screen. But if you look at the population from less than 5 years old up to greater than 85 years old, and then if you look at the population from 10,000 to 80,000 on either side, and you look at the races, which is white, Black, Hispanic, other, and Asian, what I want you to take away from this slide is how much more diverse Central Indiana seniors are becoming as the years go on. So I'm happy, I think that these slides are available to you. The thing is, I was preparing these slides, I was thinking, I could really just stand here and let you stare at the slides and not say anything, because we're developing a report. And so as we present these data, we're not supposed to have to talk about it. You're supposed to be able to look at it and figure it out. And so I will keep talking, but I do also want you, if you tune me out and just stare at the slides, I won't at all be offended. So the next slide is on mortality, and the slide on the left is premature death by in Indiana by race and ethnicity for people who are 55 to 64 years old, and early death for people who are 65 to 74 years old. I didn't say in the beginning, but I will say it now as you stare at the data, that we're looking at, they've asked us to look at young old, which is 55 to 65, middle old, which would be 65 to 74, and then old would be 75 and above. And what I will also say right now, because I'm thinking about it, in terms of the people who I've been able to access, it's really hard to access young old because they're all working and they're busy. So a lot of what I'm going to tell you today is going to be that middle old and the old. So the next slide is on disability. And disability rates, as you can see, have been mainly steady since 2010. And there's a large jump in disability for people who are over 85. So the self-reported disabilities are hearing loss, vision loss, cognitive, difficulty with cognition, self-care, or walking. So those are what came out mostly. And then we looked at notable changes, and we were asked to look at notable changes in comorbidities or health outcomes in seniors from 2012 to 2017. And so everything is trending up. And one of the questions that we asked one another as we looked at these trends, because remember, we're just looking at data. Is it because there are more people, like are there more older adults and that's why everything is trending up? Is the population larger? Is that why everything is trending up? So we're asking questions about why, when healthcare we think is getting better, are the diagnoses more common now than they were historically? So there are lots of questions, but that's not our job to answer the questions. Our job is just to present the data. But I think as researchers, we think it would be really interesting to kind of examine these questions. The other finding that we had that we thought was interesting is that diabetes prevalence has stabilized, yet the disparities continue to exist. And so we pulled those data out. The financial stability picture is that poverty for those who are older than 55 is trending down. The 55 to 64 age group has the highest poverty rate, and that's also concerning because that's the group that's not qualified for Medicare and other senior benefits. And the poverty rates for Black and Hispanic seniors is much higher than for white seniors. A story that I learned as I was interviewing is that a lot of Black older adults who live in Indiana and who have for the most of their life were mostly domestic workers, and they didn't pay into the Social Security system, and so they're not eligible for senior benefits because it looks like they never worked. They were paid cash. And so it's a concern, it's a problem that we've identified, that here are people who have worked all their lives and have worked hard and have held jobs and now can't benefit from people like us who work all our lives and have retirement benefits when we're older. So just something to think about that I'd share with you, a problem that we identified. Housing cost burden, 55 to 62 represents a gap, and that we also think that's because these are, again, people who don't qualify for certain supports. And if you see the gap between Blacks and whites is still very high among those who are 55 and older. So the forefront issues is what we worked on from IUCAR, and from CISF, the data that they wanted us to examine was living in place, caregiving of loved ones, home and community-based services versus institutional care. We also identified through our interviews issues around safety and security and also around abuse. And these data are readily available. We didn't change anything. This is from the Community Assessment Survey for Older Adults, or the CASOA report. Here are the key informant interviews that I conducted. These are not all of the key informant interviews that were conducted. These are just the ones that I did. And when we were looking for people, we wanted to look at faith-based. We wanted to look at recreation and housing and senior services. And we wanted to do it in both urban and suburban communities because that really makes up central Indiana. There's very little rural, and most of the rural is served by suburban, so we made the decision to just stick with urban and suburban at this point. And so I just wanted to show you that I conducted, these were about 90-minute interviews with semi-structured questions about senior issues. And I'm only presenting the main issues that I found. The report will have many more in greater detail, but transportation came up in every interview. And so in terms of transportation, one of the problems is that there's no transportation across counties. So if someone lives in Hendricks County and they need to come to Marion County for their care, there's no support for transportation from county to county. The only exception is there are some sources available in Hamilton County that will bring people to Marion County. But most of the transportation, it's an issue, and most of the transportation is within counties. Everyone says there's not enough funding to transport seniors the way they need to be. And there are some opportunities because 67% of the seniors do say that it's easy for them to get around, and 27% say that public transportation is easy, although we did hear that the red line is making public transportation harder. And that surprised us, and something that we will absolutely put in the report. But if you think about it, the red line lets people out in the middle of the street, technically, and it reduces stops, so they have to walk further to get to the bus. And where we're thinking it's great because it's faster and it's more accessible, they're thinking it's really kind of dangerous and harder to use public transportation. I think that we were also surprised about the number of seniors who still drive and drive one another to help each other support one another. Organizational coordination is another forefront issue that we heard a lot about, and we heard about competition for funding among groups that do similar services, and that there's a misunderstanding of who is doing what for whom. And to address these issues, there was a recommendation for a central repository describing all available services and programs. And many people said, well, SACOA does that. But SACOA said, we don't do it all, and it could be done better. There was this discussion, and maybe something that we could potentially address, of a need for a coalition to drive policy. And so there are all of these groups that are working separately to support seniors in Central Indiana, but there's no coordination and there's no coalition. And I heard from a lot of groups, they would like there to be one. And then there's this issue of intentional information exchange between healthcare and social services. And so another issue that we learned is that if a senior is not part of the healthcare system, then there's really no way to get at them unless they're proactive and going to seek the information themselves to get social services. So they're taken care of in healthcare with a social worker, but for those people who are shut in or who are not attached to the healthcare system, it's a problem. And then information seems to be an issue too, and it kind of carries over to the last two slides, but that 64% of older adults are unaware of available services. And we're starting to hear this in focus groups, where people talk about in focus groups what they need, and those needs could be met. Those services exist, they just don't know about them. We found out, and we're getting confirmation from our focus groups, that this is how older adults get their information. And I am surprised at the number of older adults who have smartphones, and we see them in their hands when we're going to talk to them. And I ask them, what do you use these for? And some of them use them for information, but most of them use them for communication with their children and their grandchildren. So they have the ability to use certain technologies, but I think, again, providing that information is really important. And then there's limited awareness on what is available and how to access it. So the Public Policy Institute went over the forefront issues, and this was probably the most eye-opening to me. And as I started, I said how enjoyable this work has been. This was where I learned the most information. And so safety and security is something that we learned about in our interviews, but there is a lack of systematic institutional provisions, and guardianship is an issue. So there are a lack of public and private and nonprofit guardianship programs in Indiana. And there's also a lack of oversight, training, and requirements and support to be a guardian. And more guardians are needed. Abuse is a problem. And usually when seniors are experiencing abuse, it's more than one type, and it's happening at the same time. And so I have data up there for physical and emotional abuse and crime victimization. And these were rated comparatively low compared to the rest of the United States. There's increasing financial exploitation of older adults related to use or lack of knowledge about technology. And so we heard from our key informants, it's showing up in the data as well. PPI did key informant interviews, and their data is coming from there. But we're hearing about older adults who are experiencing fraud. And we know that Abuse Protective Services as a parajustice agency instead of part of social services is also a problem. There are only 42 APS investigators in the state. It's not enough. And then they looked at reentry and recidivism and homelessness. And there weren't that many, so the number of older adults is pretty low comparatively, but just about 11% of the incarcerated population is older than 55. And the impact of criminal history on older adults and their ability to get work once they're released is a problem, and something that I hadn't heard about and really hadn't thought about. Homelessness is also a problem, and the largest portion of older adults experiencing homelessness, well, this is the largest proportion of people experiencing homelessness, and I think that that's the accurate statement. It's not just older adults, are older adults between the ages of 51 and 60. And there's an increase of 55% in the number of older adults experiencing homelessness. And individuals who are homeless are more likely to seek shelter. So then we all worked on the basic needs assessments, and we are seeing that the food and nutrition, shelter, sense of place, and safety and security, when you compare 2013 to 2017, which is the most recent data that are available, are really moving in the wrong direction. And food and nutrition came up a lot in our interviews. And it's a concern because although there are more food pantries, food access is still a problem. We're also seeing transportation, social inclusion, and employment moving in the wrong direction. And transportation and social inclusion also came up frequently in our interviews. So lastly, we pulled out equity just to look at it specifically and to look at veterans, and there's increased barriers to access VA disability benefits, and VA pensions are at increased risk of financial abuse. So it's easier to identify someone who's getting a VA pension and to go after them for fraud. We learned a lot about the LGBTQ community, and there is this group of older adults that are part of this community that don't feel like they can be older adults and be out, and it's a real challenge. And so what we learned about is that there's lack of cultural competence in nursing homes, assisted living facilities, and in medical care that create barriers and social isolation. 16% of the older LGBTQ adults are married, and they're 4 times less likely to have children. I'm running out of time a little bit, but I do want to really tell you a story about a gentleman who went to a retirement facility, and he's in South Bend, and he said, "I can't come out because I won't be able to live there anymore. Indiana is just too conservative; they won't understand, and so I can't be out and live in my home anymore." And I think that's heartbreaking. We also looked at immigrants and refugees, and undocumented immigrants can't access retirement benefits, although they work and they're paying into the system. And so it's a challenge. English language and skill building is a top priority. And again, there was this lack of cultural competency in nursing homes and assisted living facilities. Racial minority households are more likely to be multi-generational or missing a generation. So grandparents and grandchildren are living together without the parents. And African-American older adults don't trust the healthcare system. That's not the first time I've heard this, but it was confirmed in our interviews, and we'll talk about it more in focus groups to see if the key informants and the participants feel the same way. And African-American older adults are more likely to face environmental challenges such as food deserts and poor air quality. So I present to you our timeline. We're through January 2020. Like I said, this is a 3-year project. We still have a lot of work to do, but we're trudging through it and learning a lot of information. And we have started the report design production. So we developed the templates in October. We started writing narratives in October, November. It did bleed into December because our narratives were abundant. And we're finalizing the publication and we'll present it to the board next week. So thank you. And are there any questions? Nikki.
I have 2 questions, actually. One is about the LGBTQ data. You said that 16% of the older adults were married. Are they married in same-sex couples, or are they married to those of the opposite sex?
I don't know.
Okay.
That's a really great question, and I can look into that, but I don't know
the implications on that from like survivor policy is really huge and probably makes a huge impact. That's my first question. The second question is, as part of your report, will there be projections? With this being a 3-year project, will you also be projecting into like up to 2030? And
yes, so our hope is that they like our work and we'll continue to do the work. So 3 years is the audition. And if we are successful, we'll continue. But yeah, there will be projections. I don't know how far. 2030 seems reasonable.
Nicole,
Okay.
just a quick logistical question.
I didn't even know you're back there.
Oh, no, I'm incognito. No, that was really fantastic. This is actually just more of like a regulatory question for me. Amazing findings. Are these to be kept confidential for now?
No.
It's okay for us to tweet out the things you said? Okay.
Yeah, everything is going to be in the public domain, so there's nothing that's confidential. We don't own anything.
Great.
It's really, the point of the report is to inform policy. We're also saying that it could inform research questions. So we want as many people as possible to know that this is happening and looking for these data as we present them.
That's excellent. It's very important work. So when do you expect the report to be available? Is there a timeline?
So that's not up to us, it's up to CISF. I would hope that it would be available next month because or the preliminary report be available next month.
Wonderful.
Because we're giving it to them.
Great, thank you.
Yep.